Hello, everybody. Thank you so much for joining us here today. My name is Fabiana Pacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. And since the beginning of this pandemic, every Monday and Friday, 1 p.m. Eastern Time, I've been interviewing clinicians and parents from all over Canada. We are talking about all the concerns that parents have at this time and what is happening in ICUs across the country, and also how parents are coping at home with the babies during this time of lockdown, and some provinces already start to open up, and how we are dealing with all of that. And today we're going to talk about you and your baby, how to comfort your baby, how to continue to be involved in the care of your baby in an ICU, and certain things that you can do at home with Dr. Marsha Campbell-Yeo. She is a neonatal nurse practitioner and a clinician scientist. She's a full professor at the School of Nursing, Faculty of Health at Dalhousie University, and holds cross appointments in the Department of Pediatrics and Psychology and Neuroscience. Her Canada Foundation of Innovation funded research lab, MomLink, is located at IWK Heath Centre in Halifax. She primarily holds grants examining maternally-led interventions to improve outcomes of medically at-risk newborns, specifically related to pain, stress, and neurodevelopment, as well as novel knowledge synthesis and dissemination methods and digital e-health interventions aimed at enhancing parental engagement. Marcia, welcome, and thank you so much for joining us here today.
Thank you, Fabiana. I'm absolutely thrilled to be here. And I have to say how fitting I think that today is International Parents' Day. And I think that the fact that we're going to talk about how important that parents can be in the lives of their babies in the NICU, and what a big impact they can have is very fitting, and I'm really thrilled to be here.
Oh, thank you. So I will start by asking you, how can parents feel close to their babies and be still involved in the care, whether they are able to be present in an ICU or not?
So there's, when people talk about feeling close to their baby, there's really two kinds of ways to feel close. There's the physical closeness that we can have, and certainly for those families who are able to be in the NICUs right now with their babies, but there's also emotional closeness. And so even those families that have been adversely affected by some of the COVID-related restrictions can still feel close. And I think that this closeness really relates to our own senses and our baby senses. So again, physical closeness, I mean, the thing that comes up mostly is, of course, touch and skin-to-skin contact. And we know that the upright holding of a baby on a caregiver's chest is one of the most powerful ways that we can feel close to our babies. And we know that skin-to-skin contact, which I'm sure you talk about so much in this group, and most everyone has had the opportunity to do, the benefits are amazing. We know that it stabilizes babies' heart rates, their oxygen saturations, their temperatures. And we know that these even small amounts of skin-to-skin contact can last with benefit to up to 10 years, not just for the babies in their ability to later to regulate stress, but also in families' well-being, both mothers, dads. It's been documented how powerful that is. And so certainly for those parents who can be still with their baby in the neonatal intensive care unit, this is such a powerful way for them to feel close. But what about those families who can't be there? Well, I think we think beyond just the sense of touch. And we think of things like smell, sight, hearing, and what can those things be? So for example, if a family can't be there, many families have talked about scent cloths. and just recognizing that, you know, babies are amazing and they recognize the scent of their mom immediately after birth. And they also have the ability, even young babies, to remember and familiarize smells. So a dad or a sibling, if they're exposed to that same smell over time, they recognize that smell and it's familiar and comforting. And we know that babies who have familiar smells actually cry less, they're comforted more, they're more content. And so this is one way, even if you can't be there, you can provide the healthcare providers with your scent. The other thing that's important is singing, talking, reading. So the auditory stimulation and how you can feel close to your baby, but your baby can feel close to you. And so these are things that can be done through FaceTime, through audio recordings, in which babies can feel close and you can feel close to your baby. And lastly, things again, just by providing your baby with taste. So expressed breast milk, for instance, can be very, make you feel close and your baby to feel close to you.
Absolutely. And there's a lot of NICUs across Canada providing those scent cloths for families, right?
Yes, they are. And they just little triangles and they often will, you just put it next to your skin and you just keep it for maybe 15 or 20 minutes. And then you want to make sure, of course, it says otherwise clean, you've cleaned your, you know, and then you can provide it and they can give it to your baby. And they just generally lay it next to the baby's face. Certainly you don't want to put it over the face. You don't want to block any breathing. You want to be able to keep it in a safe area. But that can be a very powerful way for your baby to know your smell and to feel comforted.
Right. So, Marcia, is there any other safety concerns families should know about when using those techniques, besides the scent cloth being the right position, so won't suffocate the baby?
Yeah, so Fabiana, that's a great question because one of the things that we know is when you use, say, for example, a cell phone to have someone hear the voice or have singing or talking, or whether you do an audio tape, people need to remember that if you lay that next to your baby's ear and the sound sounds good to you, it's way too loud for your baby. So we know that we want to maintain about no more than about 40 to 45 decibels of sound. So we think about that. That's lower than we're talking right now. It's like it's not a whisper, but it's a low conversation or like a babbling brook. And what happens is people forget that if they use the audio tape close to the baby's ear, that they think that what they're hearing is what the baby is hearing and they turn it up. So you can either do two things. You can either make sure that you put your head really close to the baby and make sure that it's quite quiet, loud enough they can hear, but quiet, or just put it away so that it's what you're both hearing. And that you want to make sure that it's about just a very soft conversational level, because too much noise can actually cause damage.
So actually, I have a question about that. Is this something that babies can be, I mean, parents can do to babies born at 23, 24 weeks, or they are too immature? They should wait until babies are a little bit older in the NICU.
So we know that quiet conversations, a parent's voice is fine and safe for even the youngest and smallest babies. They've heard that inside of you and they can remember and find it comforting. Singing, again, low or soft music can be fine for all gestation. However, I will say it's like anything. If you are, the younger you are, or even any baby, the amount of stimulation needs to be gauged. So you need to watch your baby. So for example, if they've had a lot of activity, a lot's been going on, there's a lot of other sights and sounds, and then even low conversation might be a bit much for them right at that moment. And so babies are amazing. So some of the cues, so if anyone's seen even the little baby that does this, that sometimes that it's called hand splaying, and it's telling you, I've probably got enough right now. So maybe turn it off and then do it again later. Similarly, some of the things that we see small babies do, and even babies close to term, is multiple yawnings. And it's not that you're actually boring them. It's their way of saying, I think I've had enough. So families usually get to know very much these cues. But it's important with any type of stimulation when they're quiet and alert and listening and not fidgeting or move, they're often very engaged. But if they start or yawning, it's probably time to take a pause.
That's amazing. It's always amazing to watch the babies and try to understand what your baby's trying to tell you. And I think the longer we stay in the NICU with our babies, we learn those cues and stuff that we bring at home later on, right? Because you know the baby so well.
Exactly. And sometimes just turning away or they seem to be disengaged. Again, sometimes families think, oh, what have I done? Or they're upset, why aren't they engaging with me? But really what they're trying to say is, I've had enough right now, and I need a little break. And it doesn't mean I don't love what you're doing, because I may in an hour love it. But those cues is always important.
Absolutely. Marcia, I also want to ask about, the pain, because I know you're very interested in reduced pain associated with common painful procedures in the NICU. What are some of the things parents can do?
So thank you, Fabiana, again for asking me that. Certainly been a passion of mine. We know that babies often undergo many procedures, and we try to limit them the best we can in the neonatal intensive care unit. But nonetheless, there are things that babies, they need blood tests or maybe need a needle, have intravenous. And so I think our work and others have really demonstrated that there's about 3 optimal ways, the most effective ways to sort of reduce those needle-related procedures. And and it's interesting that 2 of the 3 most effective ways are actually led by parents. And I think parents sometimes don't realize just how powerful they are. So for example, if you have an older baby, breastfeeding is one of the most powerful ways. That's not always possible. Of course, we know in the neonatal intensive care unit, the majority of the babies aren't strong enough yet to breastfeed, or when they're first admitted. And so again, skin to skin contact with the full ventral contact on the mother's chest or the father's chest has demonstrated to reduce the pain response by about 30% that the babies experience during these needles. And we also know, of course, the use of sweet taste solutions often are provided to babies. So that could be sucrose. Interestingly, we just published a study in which we looked at and compared in a randomized controlled trial skin to skin contact for premature babies compared to sweet taste solutions, or whether or not the combination could actually be more effective. And what we found was skin-to-skin contact was as effective as sweet taste solutions, and adding them both together didn't really make it any better. So it's definitely something we can do. What people sometimes say then is, okay, I'm not there. Maybe I haven't been able to come due to restrictions of the pandemic, or I've been restricted in some way and unable to be there. So is there something I can do? So there's called what we call adjuvant therapies, in which it's sort of a meaning it, in addition to one of the other strategies, it can help reduce pain response. And some of those things, again, you have to be there. So non-nutritive sucking, for example, but again, just this familiar odor. So the scent cloth is helpful. Also voice. So anything familiar can be helpful. So it could be that if you weren't able to be there, you could ask your healthcare provider if it's possible that, say, for example, what maybe a partner is there and they're able to hold the baby. Well, maybe you could talk to the baby, or you could have your scent cloth. Or if neither of you could be there, you could ask that if they've given the baby sweet taste solution and perhaps a soother, that they could also use scent cloth, or maybe you could be on the phone with FaceTime and talk to your baby at the same time. And so those are all ways that can help reduce your baby's stress and pain.
So Marcia, talking now going home, some of those strategies can still be applied at home, because obviously we have the vaccines. And I think it's a very important time for us to talk about vaccines, because we've seen the number of babies getting vaccinated because the pandemic has reduced, because parents are afraid to leave their homes. Let's talk about the importance of keeping the schedule of the vaccines, but also the strategies parents can still use at home for vaccines, for instance.
So definitely, we know that, again, this breastfeeding is one of the most effective ways, and it works up into the first year. Studies have demonstrated that babies can be breastfed during their immunizations and vaccines safely. There's no concerns, and it's easy to do in a doctor's office or a clinic, and that can certainly be done. Additionally, if you are able to do, if you aren't breastfeeding, but you still want to put your baby skin to skin, we know that that is effective. We don't really know how long it's effective. There hasn't been the same amount of studies done looking at the duration, but definitely holding your baby close contact has been demonstrated to help with immunizations. And lastly, again, the sweet tasting solutions, there's a Kids in Pain website in which it talks about the fact that you can make sweet tasting solutions. So that can also be used prior to immunizations. So, and I think really one of the big take home is stay close to your baby. So one of the things that is the most upsetting for your child is to be placed on their back on an examination table. That makes them very vulnerable and generally increases their pain response and stress. So what you want to do is make sure the baby's upright, either close to your skin, breastfeeding, plus or minus either sweet taste solution, some form of distraction if they're over 6 months, could be a rattle or some sort of distraction. And you can also purchase over-the-counter topical anesthetics at your pharmacy. all of these things make a huge difference in your baby being able to reduce their stress and pain during their immunization, but also makes it easier for next time because babies can remember. And so when you do this right off the bat, that you're really targeted in being calm yourself, nice breaths, your baby can feel if you're anxious, you're calm, your baby's calm, then subsequent immunizations will be much easier. I do want to take a minute, Fabiana, I think you mentioned to really focus on the importance of parents maintaining their vaccine schedule. We know from reports from the Canadian Pediatric Society that there's been a significant fall off of people bringing their babies in for their routine immunizations. And we know, we can understand why. People are, why do I want to go and potentially expose myself or my baby? But at the same time, especially these babies, all babies, but those who are particularly vulnerable, it's so essential that they have their vaccines up to date and so that they're protected for any other types of viruses and concerns that they can have. So definitely reach out to your clinics, your care providers, everywhere across the country, regardless of the restrictions, are ensuring that there are safe places for babies to receive their vaccinations. And also remember, as you as your parents, that you can be and play the most powerful pain reducing strategies, as well as be an advocate for your baby.
Absolutely. I just want to give a couple of websites that we know from Canada. Actually, they are all from the researchers in Halifax. Solution for Kids in Pain, and also that it doesn't have to hurt. If you Google, it doesn't have to hurt. There's a lot of videos with great tips for parents that we are absolutely, pleased to share those videos because they were made for families and to give strategies for all the moms and dads at home, either for vaccinations or for any other pain procedures that the babies go through. But Marcia, I want to go back a little bit to the NICU. It is very difficult time where parents' presence has been limited in the units. But how can the nurses actually continue to engage the parents at this time in the care of their babies?
So nurses, of course, play such an important role in helping families feel engaged and actively involved. So, certainly if families are there, but even if they're not, again, if, for example, one partner is restricted from coming, nurses are such an advocate to make sure that families are made aware that they can be part, that they're, for example, whether or not that's ensuring that they are present on rounds, that they are actively engaged and able to ask and answer questions. They know their baby best. And also for nurses to not only offer that to families who are in the NICU, but again, to think about ways to ensure that families who are at home or a partner who's at home is able to join, whether or not that's through FaceTime or whether the unit has certain technology. And this takes a little bit of logistics because rounds don't always happen at the same time. So it's not like you can just say, call here. So nurses are really a great resource to let families know that this is something that's available to them, but not just available to them. This is something that's so important for their baby that and to help facilitate how they can be part. The other thing I think that nurses play a tremendous role, sort of to follow up on that, is providing information so families have it's a scary time. It's pretty unknown. Like families tell me all the time, like, what am I supposed to do? What is my role? How do I know what to do? And so nurses play a tremendous role in just providing education, links to resources, and helping families um, with the confidence and the knowledge to really be an active and integrated member in the team. And also, lastly, I think that nurses play such a tremendous role in the whole culture of the neonatal unit, because it's not just what one nurse believes, it's what the entire unit believes is their philosophy and the culture, and how important it is that parents really should be an active and equal member of the team, and really see them and advocate and call on them to be part.
Absolutely. And I know how passionate you are about family engagement. And obviously, as a parent who spent 5 months in the NICU, that being part of the team and being, having the nurse as my ally was such an important uh, place for me to be and understand what was my role in the NICU, and learning from the bedside nurses that really made a huge difference in my journey. And this is what we hear from parents all the time, right? How the nurses really influence their journey, their perspective into the NICU. But Marsha, you brought up the technology, use of technology, and this time I know a lot of units are looking to technology. How can we keep parents connected if one parent is possibly positive or is under investigation? And a lot of units across Canada are allowing only one parent at a time in a 24-hour period, and some units are starting to open up slowly. So technology has been playing a big role at this time, and I think will be continued, because I don't think things will change overnight again. But what do you think units can best utilize technology to keep the parents connected, or extended families or the siblings who can no longer come into the unit?
So I think there's multiple roles for technology. Again, as a way to provide consistent messages, ever-changing messages, because I think that that's what we hear is how much, especially with related to the pandemic, how things change every day. Technology also has the ability to help provide standardized message and information just on living in the NICU, what's going to happen with your baby, your role, how do I play and be fully integrated in my baby's care. And then there's the connect piece or the support piece around how people can feel close, like we talked about at the beginning, how if and not just close to your baby, but close to potentially your partner, because even outside of the pandemic, sometimes we see difficulties in families being able to maintain their typical support networks, and certainly within the COVID, we've seen that. And so there's the technology then is, what does that look like? Is that simply a online resource? Is it something that's somewhat interactive? Is it a fully integrated online resource? Or is it just a way to have face-to-face contact like we're having today with Zoom? And so we recognize that lots of challenges around that, certainly comes into accessibility, so that if you are going to do that, can everybody have equal access? And so just because where you live with your, say, bandwidth or internet coverage, that shouldn't interfere with whether or not you can receive these technologies. And also privacy. We know that there's been tremendous discussions even prior to the pandemic, but certainly ongoing, is how do we ensure that whatever technology we use, that patients and families can and feel safe and secure within those technologies.
So yeah, we still, I think, we have a lot to learn and see how will this all be unfolded in the next few months.
Yeah.
But Marsha, I want to ask you about the new study that you're being conducted at IWK on the impact of COVID. What have you seen so far? I know it's very new. We're still at the first stages, but what can you tell us about the study?
Yeah, so yeah, it is very new to us. We've been so fortunate to start a new study that we're looking at the creation of virtual clinical care pathways to help keep engage and support families during COVID in response. And it's the short term is COVES, which should be some people think it's a play on words of the COVID, but really, being from Nova Scotia, we thought about Cove is a place in when a storm and you take shelter in a cove to try to receive the support and security and safety that you need while you weather out the storm. And so that's really what we're trying to do in our study. It's a 3-part study in which first, we're just trying to understand what is the impact. What has the impact of the COVID-19 restrictions been on families in the NICU? And what types of things have helped? And what resources do we currently have that can help families? But what are the gaps? And what types of things should we be putting together? Because I think you mentioned earlier, Fabiana, while we may see some changes, and we've seen recently, and we can talk about that, where we're allowing and some changes in our presence of families and support people, but we know that this is not going to open up. There's still going to be over times, whether it's a second wave or whether it's just restrictions for other family members, siblings, etc. And so we want to know what the impact is. And then we want to co-create together with families on, is there a way to utilize technology or in a virtual way to ensure that all families get then the resources that they need, and also the support and the continued connection to their baby and to the healthcare team. And then lastly, we hope to evaluate whether or not these care plans work, whether they're equitable, whether there's certain families, because I think it's also important to recognize that every family is different. Mm-hmm. And we need to think about creating these core pathways, but then looking at special considerations in which we might need to adapt. And then evaluate the impact both on babies' well-being as well as parental well-being. So we're just kicking off. We've just started and our first looking at our impact assessment. We've been having focus groups with parents who are living now in the NICU. With babies in the NICU, but also those who've been recently discharged who were there since most of the restrictions, since about the 1st of March, to really ask them what has been the impact. And we're also talking to healthcare providers. And, it's already, we're seeing themes that I'm sure I'd love to hear what some of the families online might think, but certainly what we're hearing from families is the devastation of feeling alone, isolated from their partners, unable to be near their baby, but also some of the positives around how they felt that the staff have tried to create opportunities for them to stay connected, the utilization of some technology that had been held up, that's never been able to be used before, that sort of overnight became available, that wasn't before when you lived 2-3 hours away, you couldn't use, but now you could. So, and also things, families, we began to provide meals to all of our families, which made a big difference. Uh, and then of course our healthcare providers and their transition to becoming even more of a support person to families who felt isolated, trying to bridge that, being able to provide support, but also trying to create new ways for families to reach out to their usual support networks. So those are a few of the things that we're hearing.
Oh, that's very interesting, Marsha. I really want to see the result of your stage by stage, what's happening and how families and the healthcare professions are really being impacted by all these changes, these unexpected changes that, times that we are living right now. But Marsha, I want to thank you so much for your time today, for sharing all your expertise, your passion with us, and all the amazing work that you're doing in Canada. Thank you so much.
Thank you, Fabiana. It was just a pleasure.
Thank you. And for all of you at home, thank you so much for watching us here today. And on Wednesday, Kate Robson, who is a psychotherapist and also a mom of two preemie girls, will be hosting a real-time peer support group here on Facebook. To get the link, you have to join the Canadian Preemie Parent Support Network, which is our private group for parents only. And on Friday, we're going to be talking about sleep. And this is a concern that many parents have with their babies once they get discharged. And I will have here with me Alisa Bitts. She's a certified child sleep consultant from Winnipeg. Thank you, everyone. Have a good week. Bye now.
Thank you. Bye.